Hello, I'm Dr. Susan Kolb, the author of The Naked Truth About Breast Implants, and we're here at my clinic in Atlanta, Georgia, Plastic-O-Surgery Center, to tell you a little bit about the problems you could potentially have with saline breast implants. Saline breast implants became very popular after 1992 when a moratorium was placed against silicone implants by the FDA. And hundreds of thousands of women rushed to get the implants thinking that they were safe. This, however, is not necessarily true. Just like any device, saline implants have a shelf life. And in general, the implant companies and the doctors have found this shelf life to be between 8 and 15 years. And therefore, we recommend changing the implants out every 10 years. These are two saline implants. This is a textured implant which has a rough surface, and this is a smooth implant which has a smooth surface. This implant potentially can flake off and get into the capsule and go on into the lymphatics, into the lymph nodes, and cause a foreign body reaction within the lymph nodes that might lead to problems such as infection within the lymph nodes and even possibly lymphoma cells, which have been found recently around textured implants. This implant probably is not worth the risk of the implant is not worth the benefit of the implant in terms of potential problems with infection and lymphoma cells being found around the implant. This implant is what we usually use. This is a smooth implant. It does not flake off and get into the lymphatics and get out into the body. It, however, is a mechanical device and it has a valve. This is a Mentor implant. The Allergan implant has a larger valve that's a little more sturdy. And these valves can leak, especially if one is exposed to sudden chest wall trauma, such as a car accident, or even a very rough mammogram. Once they leak, they may not deflate entirely. If they deflate, then the women go ahead and get them out and no further problems result from it. They simply exchange the implant out and they don't get sick. However, if the leakage is just a little bit, it is possible, especially if the woman lives in a moldy environment or has mold or fungus in her body from pre-existing medical conditions, it is very possible for mold to end up either in or around the implant. Now, oftentimes this is not a mold infection. This is just a mold contamination, and it's very, very difficult to grow out on fungal cultures or anything else because it's not what we call a pathogenic mold. It's just simply there. And I contacted the head of laboratories when I was trying to determine the cause of this, and they told me yes, they actually had mold growing out, but it was a contaminant. But it wasn't a contaminant. And many of these molds can produce biotoxins. Biotoxins are very small molecules that usually stay on the same side. So if you have a left breast implant that is filled with saline and has mold in or around it, and the patient is susceptible to what we call sick building syndrome, these biotoxins will cause neurological problems on the left side of the body but not the right side. You may get muscle twitching, you may get arrhythmias, you may get burning pain in your chest wall. These are all signs of potential biotoxin problems. Biotoxins also affect the immune system by decreasing natural killer T cells, and as such, wipe out your immunity. What happens then is often periodontal disease or sinus infections, or if you're prone to it, bladder infections that won't go away, viral infections, upper respiratory that won't go away, and you stay sick a lot because your immune system is weak. Your energy also goes down because with the production of these biotoxins, you get fatigue, muscle ache, and mental clouding, an actual disruption of the Krebs cycle, which is the cycle that produces energy for the body. So this is a big discoupling of the energy systems of the body, and you go to your doctor and they can't find anything wrong, especially if you have no chest wall symptoms. Now, with the decreased immunity, usually what happens over time is that then bacteria from the bloodstream, you might get your teeth cleaned, you might have a bladder infection, the bacteria land on the implant and then cause a bacterial infection of the chest wall, which is associated with pain, burning pain, that doesn't respond to anything other than antibiotics. But once you take the antibiotics away, the burning pain returns because this is an infected foreign body. The scar capsule around the implant is infected, and often there's contaminant material, sometimes even frank things floating inside the saline that we can see at surgery. So many doctors feel that you don't have an infected breast implant unless you have redness, swelling, and tenderness, an elevated white count, and fever. However, this is not usually how infected breast implants present. Many patients, due to the biotoxin, have an endocrine disruption, which means their thyroid isn't working well, their adrenals are not working well, they don't have ADH, so therefore they drink and pee all the time and shock things because they don't have antidiuretic hormone. And the bottom line is that because their low thyroid prevents them from actually getting a fever, they may have a fever of 100 degrees, which in actuality is about 101.5 for a person without endocrine disruption. So and their white count may not go up because of the immune problem. So you see, it might be very difficult for a regular doctor not familiar with sick building syndrome to diagnose this problem. Sick building syndrome is caused by inhalation of just the biotoxin, usually through the air conditioning or other systems in the building which spread the biotoxin. The person isn't usually contaminated with mold like we see with the breast implant patients. So when you have the fibromyalgia type symptoms after you get breast implants, which usually occurs 8 to 10 years out, in most patients who are susceptible to fibromyalgia, you will find that only removal of the implant along with the entire scar capsule, you can't leave a part of it behind because it's too hard to remove. You have to remove the entire scar capsule, you have to treat with perioperative antibiotics and antifungals, and you have to drain for 5 to 7 days. If you don't drain, the fluid within the chest wall will often get reinfected, another capsule will form, and then the only thing that really will take care of that is another surgery. It is important at the time around surgery to remove the entire capsule, to remove any abnormal lymph nodes, and to treat with appropriate antibiotics and antifungals. If you don't treat with if you don't treat with antifungals and only with antibiotics, you find that the condition really worsens, including the systemic symptoms. So it's very important to find a doctor who understands the disease. And if your plastic surgeon has never heard of sick building syndrome, if your plastic surgeon tells you that these implants that you have are not affecting your systemic health, you need to look further. Much of this is in my book, The Naked Truth About Breast Implants. And if you go to www.thenakedtruthaboutbreastimplants.com, you may read Dr. Shanklin's foreword on the book. Dr. Shanklin is a prominent silicone researcher, and he has written a very interesting foreword, and you can also see the table of contents and other reviews of the book there. This book contains a lot of information not in the medical literature, not known to the medical professionals, because it comes out of our clinic's experience here with hundreds of women who have become sick from saline implants. More rarely, women become ill because they have a certain HLA or genetic type that cannot tolerate any silicone whatsoever within the body. These two are HLA B27 and HLA DR53. With this, any silicone, it doesn't have to be a breast implant, it could be a lining around a pacemaker, it could be a chin implant, it could be anything, even VP shunts, which are made of silicone. Any silicone within the body, within about the week, the patient will start to develop a pretty severe autoimmune disease. So these patients should never have silicone put in their body. And they often have a family history of autoimmune disease, especially one called ankylosing spondylitis. So that's a clue to women who have that high degree of autoimmunity within their families to not get any breast implants put in without having HLA testing, or you can get very sick very quickly. Fortunately, taking the silicone out does help. Remember, this is a silicone shell with saline inside. Rarely on your older saline implants, they used a catalyst of platinum. And platinum has been found to not only cause problems within the person that has the implant, especially once the implant starts to degrade a little bit, but also be potentially passed on to other generations. And this problem is such that the older saline implants probably should go ahead and be removed at least by 10 to 15 years. Many women tell me, well, I'm not having any problem with my implants, so I see no reason to remove them. That's true, but you must remember that these are mechanical devices and they will fail with time. The longest I've ever seen a saline implant last was 30 years. But you must remember that that implant was a very, very old model Dow Corning implant that looked entirely different than these. These are much more flimsy shelled. The valves are very, very different. And these implants have about a 10-year lifespan. Again, please take a look at the information at www.thenakedtruthaboutbreastimplants.com and contact us at 770-457-4677 or via email through the website with any further questions. I'm Dr. Susan Kolb, telling you today about saline breast implant problems.